Let's have a look at OET Reading Part A by E2 Language. So as I said, in today's class, we'll learn how to complete Reading Part A fast. Then at the end, I'm going to give you a sample Reading Part A mock test, okay? It'll be a little bit simplified, but it'll still be good. So let's run through the steps for completing Reading Part A. Here's the method. Now, it looks like there's a lot of steps, but a lot of these are very simple and you should be able to do them just very instinctually. Number one, you read the title. Number two, you'll identify text types. I'm going to walk you through these steps part by part, okay, step by step. Number three, you'll skim read the texts. Number four, you'll find out that there are some clues in the summary which lead you to the particular text you need to read. Number five, you'll need to speed read back and forth. And number six, well, while you're doing number five, you'll be completing the summary. So let's think about reading the title. So you need to familiarize yourself with the topic. All four texts that you will see on test day will be related to the same topic. Just quickly scan your eyes over this and tell me what is the topic of the four texts. You have 5 seconds. That's right. The four texts that you will be reading about will be about dementia. And you can see that right there. That's a handy little thing to read just to familiarize yourself with those four texts, which leads you to step number two. You should be able to identify the text types. This comes in handy when we get to step number 5, where we speed read back and forth from the text, and also step number 4, where we find clues in the summary. Before we do any of those things, we need to identify the text types. So we need to quickly determine them. Is the text a summary for patients? Is the text an abstract of a journal article? Is it a case study? Is it statistics or something like that? So just spend 20 seconds. I want you to identify what type of text each of these four are, okay? Just in your mind, A1, A2, A3, and A4. What are they? It's probably pretty small, this text on your screen, especially if you're watching this on your phone. So maybe you can't see it very clearly, but what we're looking at here are 4 different texts. Text A1 is a Q&A. If you look very carefully here, there's a Q and there's an A and there's a bit of a few dot points there. So it's a Q&A or it's some sort of informative text there. Text A2, well, you can see this big graph here. We could think about that as statistics, or probably best to think about it as statistics rather than line graph. Text A3, well, this is an abstract from a journal article, an academic article. It has objective, method, results, conclusion, hypotheses, participants, analysis. All these words will show us that this is some sort of abstract. Text A4, well, treatments for dementia. Need to pay attention to headings and subheadings, medications, therapies. So this is treatment information, text A4. Cool. That should only take you like 20 seconds, right? So let's say we're 25 seconds into our reading part A. What we've done is identified the title or the theme of the 4 texts, and now we've identified the texts themselves, which leads us to step number 3. We need to skim the text. What I mean by skim is it's different types of reading, right? There's a type of reading when you're lying at home on the couch and you're just reading your novel very slowly and very relaxed and enjoying it. There's a type of reading where you're reading something very complex and you're reading it very carefully and very deeply. There's also another type of reading where you're skim reading, which means you're not really reading per se, more sort of looking / reading. What you're doing really is you're going, okay, what is this thing? You look at titles, you look at headings, you look at subheadings, you look at keywords to get the main idea of what this thing is about, okay? That's what you'll need to do for about 1 minute on test day. So to skim read, we need to read quickly for the headings, the subheadings, the keywords, and the main ideas. Do not read every word. You don't have time. Remember, you only have 15 minutes for all of reading part A. Give you 30 seconds. I want you to skim read for headings, subheadings, keywords, main ideas. Okay, what you're doing when you skim read is you're trying to memorize as best as possible. I know you're only spending like 30 seconds on this, but you're trying to memorize keywords and what this thing is about, right? Because when we go to the summary and we're going to start to find clues in the summary, we need to be able to go, yes, text A1 talked about elderly patients, or text A1 talked about delusions and agitated behavior, for example. Okay, so you're reading very quickly, yes, but trying to absorb some of that information to memorize it. Okay, so with the next one, I want you to do it again. Try to memorize some of the key words if you can. Here we go. You're also going to have to try to understand this line graph in 30 seconds. Okay, so hopefully you read this. Causes of death, or leading causes of death in Australia, incidents per 100,000, heart disease. Okay, heart disease is very high. Dementia's there, stroke, lung cancer. Okay, remember we're looking at dementia specifically, so we're probably going to have to pay attention to this dark red line here. Good. And now this will be interesting information too. So we skim read this. We read this very quickly, pick up some keywords there. Now let's quickly skim read the research abstract. Okay, what you want to do is do it systematically if you can. So the first thing you'll read, of course, is the title: Physical Activity, Cognitive Decline, and Risk of Dementia. Objectives. Okay, right. Characterized by decline in physical activity. Method. Okay, so number of participants, what they did, how they did it. Cognitive test, 1997, 2013. Right. Results. Okay, no association. 15-year cognitive decline, 27-year follow-up. Trajectories, 28, 10 years behind. This is the sort of reading you're doing. Conclusions. Okay, no evidence of this. Previous findings, lower risk of dementia, physically active people. Cool, got it. Move on to text A4. All right, hunky-dory, fantastic. So what have we done so far? Well, we opened our test booklet on test day. Let's say this is our test booklet. We've opened it up. Okay, you can begin. First thing you do is look at the title. Okay, we're reading about dementia. Second thing you do is identify the texts. Okay, so we've got a statistics, we've got a research abstract, we've got this, and we've got this. Fine. Now we want to skim read each of those and spend like maybe 30 seconds on each. Okay. Looking at titles, looking at subheadings, looking at keywords. What's the main idea? Memorize as much as possible. Next one. What's this one about? Because they'll have slightly different, they'll all be about dementia, but they'll all each have slightly different topics. One will be about, physical activity and dementia. The other one was about risk of death from dementia, whatever it is. Okay, so then you memorize as much as you possibly can. Cool. Where are we up to now? So just before we get to the next step in the method, as I mentioned, if you're doing OET 2.0 in September, E2 Language will be releasing its OET 2.0 course on August the 13th, which will give you 1 full month to prepare for OET 2.0. So if you are preparing to take that OET 2.0 in September, the first time that they use this new test, come to e2language.com. What you can do if you want to start preparing now for it, you can sign up to our current course, and what we'll do is we'll transfer you to the new course if you're taking that in September, okay? Or if you're unfortunate and you don't get the results you need in this upcoming test or in the August test, that's cool. We'll transfer you to the new 2.0 course as well. So all good. We're preparing a really, really good course, okay? So it's going to be everything you need for OET 2.0. Okay, after that TV commercial, let's move to step number 4. This is probably the most critical step in many ways. We now want to move to the summary. Okay, we've looked at the texts. We know what they're about. Now we move to the summary. And we need to identify clues in the summary. Okay, what I mean by that is this. In the summary, you might see a sentence that says, or the first sentence says, one study showed. Now, which text do you think you should be looking in if it says one study? Well, would you go to the Q&A? Probably not. Would you go to the statistics? Yeah, probably not. Would you go to the journal abstract? Probably. Or maybe that first sentence says something about participants or methods, or maybe it says something about control group. Okay, these kind of language, these kind of words, you go, that must be in the journal abstract that I just read. And then you go there because now you know where you're going or which text you're looking in to begin to fill the summary gaps. Okay, this is critical. So let's look at the second one here. If it says something like percentage of patients, well, you're probably going to look at the statistics text. Maybe it says something like sufferers often complain of. You're probably going to go to the information for patients, the Q&A. Or maybe it says something about, medications. Well, that you'll probably go to the text about treatment information, okay? So let's do a little quiz. I want you to quickly scan, read paragraph 1, paragraph 2, paragraph 3, paragraph 4, looking for keywords that will give you clues as to which text you will be looking for. So in paragraph 1, where would you find this information to fill these gaps? In the Q&A, in the statistics, in the abstract, or the treatment info? In paragraph 2, there's going to be words that give you a clue as to which text you need to go to. For paragraph 2, well, you need to read the Q&A, the stats, the abstract, or the treatment info. Give you 30 seconds. Just a little clue. Some of them will include just from one text. Some paragraphs might include more than one text. Let's see how you go in 30 seconds. I'll give you another 30 seconds. Okay, cool. Hopefully you were able to look at those paragraphs, see some keywords and go, okay, risks. Oh, that was from that was from that text, or treatments. That came from treatment information. Now, I don't want to mislead you. I don't want you to look at the entire summary on test day and do this. I want you to start from the first paragraph and do it paragraph by paragraph. So you start with paragraph 1 and you look, and then you go, oh, okay, that must be from the journal abstract. Then you go to the journal abstract and start filling it up. Then you move to paragraph 2 and you go, there's a keyword that must come from the statistics. So then you go to the statistics and start doing that. The reason why this is so important is if you're wasting time looking around at the different texts thinking, where will I find the information here? You know, the clock's ticking. So you want to go immediately to the right text to find the words to fill the gaps. Cool. And as I said, in the summary, each paragraph will relate to one text or two texts. And usually what will happen is if it relates to two texts, half of the paragraph will relate to the first text, and the second half of the paragraph, the second half of the gaps will relate to another text. So it's not mixed up, but that's a little bit of a tricky thing that you'll have to wrap your head around. Okay, let's look at the answers to these ones. So paragraph 1, the information you would find in the Q&A text. Paragraph 2 actually came from two texts, the Q&A and the abstract. Okay. For example, look here. I'll give you a great little clue. Participants over 27 years. That's directly taken from the abstract, right? This is maybe from here, it was talking about symptoms, stories. That comes from the Q&A. Let's look at this one here. Let's look at treatment info. Well, you can see this keyword here, therapies. So you know that comes from the treatment info text. What about here? Well, we've got numbers, 100,000 deaths, for example. What else did it say? Yeah, we've got some years here. That could come from the journal abstract, but if you look carefully, this one's a dead giveaway for a dead giveaway. There's a pun from the statistics there, okay? So this is subtle, this is difficult, but this is the kind of information that will help you to do this very quickly on test day. Okie dokie. We've now run through that part of the method. Let's just quickly recap what we did, because now I'm about to hand it over to you to do some speed reading to actually complete the gaps in the summary. So on test day, you get your test booklet. They say, okay, you can begin. You open it up. You see the title of the 4 texts, okay? It's about headaches, or it's about toothache, or dementia, or whatever. There's the main, got it. Okay, this is what I'm reading about. Then what you do is, I've completely had a brain fade. I don't want to embarrass myself and get it wrong. Let me go back to step 2. Of course, you identify the text types, okay? So you identify the text types. You look at that first one, you go, okay, that's a journal article. Text B, statistics. Leads you to step 3, where you need to speed read for headings, subheadings, keywords. Step 4, you'll go to the summary, and you'll start to see clues in the summary where you go, that came from the journal article. That came from the statistics, okay? Cool. All right, let's do some practice now. Here we go. So this is step 5 and 6. You need to speed read back and forth, and you need to complete the summary. Let me give you a couple of hints before we begin. First of all, the answer to fill that gap in the summary can be 1 word, 2 words, or 3 words maximum. Here's another hint. You may need to change, you will probably need to, if not all of the time, change the form of the word to complete the summary. For example, in the text, it says patients should be prescribed, but in the summary, it says patients should receive a prescription of. So we've changed this past participle to a noun form. So a participle to a noun. So you may need to change the word form to fit the gap so it works grammatically, okay? Cool. Now, these questions, hopefully you can read this, are simplified. On test A, you'll find it a little bit more difficult. What I've done here is the answers to the gaps are usually 1 or 2 words max. So on test A, it will be a little bit more difficult. Anyway, hopefully you can read this. I'm going to give you a minute to see if you can answer 1, 2, 3, and 4. Okay. Do you want more time? If you're in the Zoom webinar, just write more time. Or if you think that's okay, just write okay. More time or okay. Okay, I'll give you a little bit more time. Let's do another 30 seconds. Actually, have another 30 seconds just to make sure you've got it right. Okay, cool. Couple of things before we move on to the next part. One, hopefully from that little exercise, you're starting to say to yourself, I can do this. I can do it. I know how to do it. See, a lot of the problems people have with reading part A is simply just understanding what to do, because it's really complicated. There's lots of different parts. There's lots of different strategies, etc. But once you start to go, I see how to do this. I see how to do this. I skim read the paragraph. I find a clue. I find the text. Remember, you have to go back and forth, back and forth. So you read that summary and you're looking for a specific noun. For example, you go to the text, you find that noun, but it needs to be transformed. Boom, you pop it in there. So hopefully that's happening to you. Now, second thing I want to say is maybe grab a pen and a piece of paper and write your answers down, because we'll look at the answers at the end to see if you get them right. Okay. And this one, I'll give you 4 minutes. So we'll do this timer twice. And you're going to have to scan read between the two texts here. Remember, some of the answers will come from this text, for example. Some will come from this text. Okay, unfortunately, a lot of people can't see this because they're doing it on their phone and it's way too small. So what we'll do is we'll keep moving through. For those of you on your laptops, on your computers, this is probably fine. So I won't give you more time because what you can do is I'll leave this video on YouTube. So please, if you're on your phone, you may need to come back, log into a laptop, do this later. So please do that. By the way, if you're on YouTube Live, you're watching this, please click the subscribe button down there and become a subscriber to our channel. So whenever we do a live stream or update a video, especially for OET 2.0, you'll get an alert and yeah, you'll be able to watch that immediately. So let's push through. I think this is going to be too small for those of you on your phone. What we'll do instead is, if you come back later, you can pause the video, give yourself 2 minutes and see if you can do this. Instead, what we'll do, let's go back. What I want to do is I want to point out another little hint here. Okay, let's have a look at this number here, number 7. It says, however, a study of something participants over 27 years. There's another little clue you can derive here, which is what type of word do you think could fit in this gap? A study of something participants. We know it's going to be plural or it's going to indicate plurality. I don't know about you, but I'd be looking for a number to fill this gap, for example. So that can help you. If you look at the gap and you look at the surrounding words, you can begin to determine what type of word you will need to fill that gap correctly. Let's have a look at another one. Okay, a decrease in physical activity was shown up to something years before diagnosis. Again, it's probably going to be a number. Okay, there was no association between physical activity and something decline. Number 8. Okay, this is a good example. So if we've got physical activity and something decline. Now, activity is a noun, decline is a noun, or it could be a verb, but in this case, it's a noun. So this is an adjective, physical. So what we're going to be looking for here is also probably, or you could almost say definitely, an adjective to fit this gap, something decline. Okay, so again, if you look carefully at the gap, you look at the surrounding words, you can determine what type of word will fit that gap. Now, I'll just skip through these because unfortunately for most people on their phones, they won't see this. Again, you can come back and watch this on YouTube later and just pause it and do it. So let's go through some of the answers just for the first part. Number 1 was symptoms. Number 2 was memory loss. Number 3 was repetition. Number 4 was neglect. So I'm not sure if you got those there. Hopefully you did. And don't look at the answers too long if you're planning to watch this video again. Cool bananas, guys. Remember, if you need any help with your OET, just go to this website here, www.e2language.com. If you're taking OET 1.0 for the July test or the August test, we've got you sorted. And if you're taking OET 2.0, no problem at all. What you can do, in fact, if you're taking OET 2.0 to get started, is this. Let me just go to this website and I'll show you what you can do. Okay, so if you go to occupationalenglishtest.org, which is the official website of the OET, and if you hover over prepare here from September 2018, there's a start for success package. So if you click this, you'll need to put in your details. But what this does, it takes you to, it was created by E2 Language, and it gives you a good overview of OET 2.0. It gives you overview videos, methods lessons, a full free practice test, as well as lots and lots of other stuff as well. So yeah, cool. Anyway, you know where to go if you're doing OET 2.0. All right. I'm sorry about the technological restraints there. Nevertheless, I'm going to hang around and answer some of your questions. I'll start with the Zoom webinar. So if you have any questions, please pop them into the chat. Excuse me. Here's a good question. Jay, what's the difference between OET 1.0 and OET 2.0? Okay, so speaking and writing are exactly the same. There's been no changes to speaking and writing. Reading and listening are quite significantly different. So with OET 2.0, there are now three reading subtests. They're still reading part A, and it's still 15 minutes, and it still requires you to speed read among texts. However, the question types have changed. It's no longer filling in a summary. It's different types of questions like sentence completion and short answer question and a matching task. Okay. In many ways, it's less challenging. Okay. The second part of the new reading test requires you to read 6 short texts and answer a multiple choice question on each of them. The third part of OET 2.0 reading is the same or very similar to the current the second subtest in the current one, where you have a longer text and you'll have various multiple choice questions about that text. Listening has also changed in OET 2.0. For OET 2.0, listening part A is no longer taking notes while listening. Instead, it's completing a set of pre-prepared notes that have gaps in them. So you can imagine you have the patient, you have the medical history, you have this, 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 and this, and you will complete the gaps in the notes. It's probably, well, not less challenging. It's just, it's easier to know what to do. It just makes sense when you look at it. You go, this is what I have to do. Got it. Still difficult to listen properly. Listening part B for OET 2.0, you hear short little audios. It might be a doctor talking to a nurse, or a doctor and a doctor, or a patient and a nurse. And you just have to, it'll have a function. The question will say something like, what does the doctor tell the nurse about the blood transfusion? Okay. And they'll be talking back and forth about the blood transfusion, and then they'll arrive at some conclusion, and it'll be A, B, or C. Listening part C in the new test is pretty similar to the existing part B. There's a longer lecture or an interview, and you have to sort of work your way through answering multiple choice questions. Anyway, it's good. I think the update's an excellent update, by the way. Okay. Jay, I'm an existing member of E2 language. If I need OET 2.0, will you transfer me over for free? Yes, we will. Yes, we will. Jay, can you give us some tips for writing? My exam is tomorrow. Okay. 4 things. 5. Read the task first. Okay. Forget the case notes. Go straight to the task. Find out who you're writing to and why, and whether the person you're writing to knows the patient already or not. That's critical. That's like your essay question. Okay. It's the equivalent of your essay question. Step 2, after you've read the task, interpret the case notes. This is all in the 5 minutes reading time. Make sure you interpret those case notes correctly. Step 3, select case notes relevant to the task. So if you're writing to a physio, don't tell the physio stuff about, I don't know, whatever's not relevant to the physio. Think about who you're writing to and include information relevant to them. Step 4, you need to think about how you're going to organize your letter, okay? You need to prioritize important information. You need to push down the letter into a you shouldn't prioritize unimportant information, okay? So think about your letter like an upside down triangle. You're going to put the important information at the top in the introductory paragraph and in the first paragraph below that. And then the secondary information, maybe the miscellaneous information. There's that type of letter. If you're a doctor, you may have to structure your letter in a chronological way, which means you talk about the first time they visited and the second time, the third time, finally they visited with this, but it's still putting the priority at the top of the letter. Finally, you'll finish the letter with a request. And the final step, step 5, is to transform those case notes accurately into correct grammatical English. Anyway, all of that stuff's in the course, so you should check that out. Jay, do you have any OET Part B reading techniques? Yeah, here's what I suggest you do for reading Part B. Read the question prompt, then read the text, then read the answer options. Don't read the question prompt and then the answer options because you'll just get confused. Okay, read the question prompt. It might say something like, what is the main idea of paragraph 6? Then read paragraph 6 and think to yourself, what's the main idea here? Completely non-distracted by those other possible options. And you're thinking, oh, okay, the main idea is this. Then go to the answer options and go, okay, it's not that one, it's not that one. There it is there. Excuse me, I need some water. Jay, how do I address a widow in a letter? Yeah, I don't know actually. It will tell you in the task and it will tell you the title of the person you're right, of the patient rather, right at the top of the case notes. It'll say something like, Mr. John Smith is a patient in the clinic in which you work. Okay, so you'll call him Mr. John Smith or Ms. Sarah, blah, blah, blah. Okay, I'm currently an E2 Language Silver member, but I want to take OET 2.0. Is it a good idea for me to practice the current reading and listening activities in the website? Yeah, I think it is because they're similar. They're similar and the skills you use are the same. Okay, the tests themselves are different, but the skills are the same. So yes, I think it's a good idea. And again, when we release our course on August the 13th, boom, we'll transfer you over for free and you'll get full access and you'll have a good 1 month before your actual test. Jay, in writing, do we need to put the date of birth of the patient or the age? It depends on what it says in the case note. Sometimes it'll say, you know, Mrs. Sarah Smith is a 72-year-old patient. So you'll just put 72 years. Don't do mathematics about date of birth. Or it'll say, Mrs. Sarah Smith, date of birth, you know, whatever, 6th of June, 1945. Then you put that. Excuse me. Bruno, Jay, I need to improve my writing from C to B. How hard can that be? I'm quite sure that I completed the task itself, but I'm not sure about my grammar and vocabulary. Well, the way you wrote that question was 100% correct. So maybe it's not your grammar. And grammar's not such a big thing. What you need to think about in OET writing, it's quite different from IELTS. In IELTS, they want sophisticated and varied vocabulary. They want sophisticated and varied sentence structures. In OET, it's about clarity. Really, it's about selecting the relevant case notes and organizing them in such a way that it's logical and the most important information is clear. Okay, it's got a different function to IELTS. Jay, I got a C in writing. Should I ask for a remark? If you need a B, I would say no. If you need a C plus, think about it possibly. If you, yeah, I wouldn't, yeah. I'm an E2 Language Platinum member. I'm planning to take the test in October. How can I get the new material from OET 2.0? You can sign up now by going to occupationalenglishtest.org to the new Start for Success 2.0 package, okay? You'll need a different email address and username. Come August the 13th, when we release our new course, we'll transfer you free of charge across to OET 2.0. Okay, some people are asking me questions about weightages, like how much is this worth and whatnot. Okay, so for reading part A is worth 33%, whereas reading part B is worth 66%, twice as much. For listening, I believe it's worth 50-50, but please correct me if I'm wrong. Jay, in writing, what date do we write at the top of the letter? Is that the discharge date or the date of the exam? That will be the date of you take your exam. You may or may not include the discharge date. It depends, A, if you're writing a discharge letter, and B, whether it's relevant or not. It probably will be relevant. But the first thing you do on test A in writing is write right at the top of your letter, well, when's the exam? 14/07/2018. Boom, that's how you start your letter. Then you move down. Okay, great question. Jay, in reading part A, if I fill the gap in the summary, but I forget to put the article, will that be counted as correct or incorrect? Incorrect. It needs to be grammatically correct for you to get the point. Okay, so you need to think carefully about whether you know, let's say the key word you're filling the gap with is procedure. Now you need to think, okay, is it procedure or procedures to fit this gap grammatically? So you need to make decisions like that, or a procedure. Jay, in writing with medications, do we capitalize medications or not? Okay, the simple rule for this is if it's a generic medication like paracetamol, it's not a brand name, it's just paracetamol, it's lowercase. If it's a brand name like Panadol, then it will be uppercase, okay? It's not a big issue, but just keep that in mind. With diseases, some diseases have been named after people, I believe, like Crohn's disease and Alzheimer's disease. These have capital letters. Other diseases like, you know, hypertension, obesity, they don't have capital letters. Oh, here's a good question. Jay, will your OET 2.0 course be for doctors or nurses? It will be for both doctors and nurses. So there will be, I don't want to say this actually because I'm not 100% sure. There will probably be 5 writing subtests for nurses and 5, there'll definitely be 5 for nurses and probably 5 for doctors as well. Yeah. Jay, are we allowed to write on the case notes? Yes, after the reading time is over, you're allowed to mark the case notes with your pen. That's fine. Jay, how would we sign off the name of a... I'm not sure what that question means. Oh, okay. Jay, if I sign up to E2 Language and take a one-on-one expert tutorial with one of your expert teachers, I'm saying that. It's true, but I'm saying that. Can I record the lecture and watch it later? Yes, you can. Yeah, you just need to ask when you're in the tutorial with the teacher, you just say, excuse me, can you allow me to record this? And they press a button, then you record it. You have your tutorial on writing or speaking or reading, whatever. As soon as the 45-minute tutorial ends, it downloads to your computer as a video file that you can watch again. So this is excellent for speaking, for example, because you can watch yourself, see what you're doing wrong, listen to yourself. It's very helpful. Jay, in reading part A, how many questions should we answer to score a B? Well, I've spoken to I've spoken to some candidates who say that they only managed to finish 15 questions out of 20, for example, and they still got a B. So it is possible to not complete the summary and still get a B. Yeah. Yeah. Not for reading part B, for example, though. Make sure you finish that one. Look, actually, let me backtrack. With reading part A, the name of the game, your aim should be to complete the summary. Even if you're a little bit reckless and you have to guess some. One of the things I was telling a candidate this morning was that if you're going through the summary, let's say you get number 1, you get number 2, number 3, you get stuck and you can't find the answer, you're wasting time, it's been about 30 seconds, skip it, go to number 4, got it, number 5, got it. Then if you have 30 seconds at the end, you can go back to number 3, and because you've read across those 4 texts so many times, then you go, it's here, yes, got it. So do skip questions in reading part A and come back to them. Pumper Paul says, Jay, I'm a doctor. Most of the classes you do are for nurses for writing. Can you please do some writing classes for doctors? It's the methodology of interpreting correctly, selecting for relevance, organizing logically, and then transforming accurately. It's the same for any profession. But if you want some additional video lessons, click on the recorded classes tab in your platform on et2language.com. There's actually quite a few videos in there for doctors that focus on writing for doctors, actually. So there is a few. They're not in the course, they're actually in the recorded classes tab in the website. Here's a good question. Jay, when I'm writing about children, do I have to use master as the title for the patient? No, it's a little bit archaic and outdated. So if you're writing regarding a child, let's say the child's name is James, you would just say, use his first name, James. You wouldn't call him Mr. Smith, just call him James. You know, James and his mother presented at the clinic today. James is unfortunately suffering from whatever. Jay, in the reading time, in the writing section of the exam, can I underline stuff? No, unfortunately, you cannot use your pen during the reading time. Jay, in writing, do we lose marks if we write more than 200 words? No, but okay, so first of all, that refers to the body of the letter. So the address and the dear doctor and the regarding Mr. Smith don't count. The introductory, it starts from your introduction. I am writing to refer, blah, 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 blah. It's from there, right down to yours sincerely. That's the body of the letter, your paragraphs. So that should be about 180 to 200 words. If it's more, it's okay. If it's less than 180, you've probably got a problem because you've probably excluded relevant case notes. Now, here's the thing with writing. If you're not sure if you should include the case note or not, include it. It's better to include something irrelevant than to exclude something relevant. I think that made sense. Yeah. Jay, I'm planning to take OET 2.0. Would you recommend me to sign up to et2language.com and practice on the 1.0? Yes, because the writing and the speaking are exactly the same and the skills for reading and listening are the same. The tests are a little bit different, quite different, but the skills are the same. Now, I just realized I'm neglecting everybody in YouTube Live. I'm sorry I can't get to your questions. There are literally 190, there are 250 people watching this live class. So if I don't get to your questions, I apologize. I'll answer a few more, but then I have to go because I have to continue working on our OET 2.0 course. Jay, in listening, is incorrect spelling penalized? No, you can spell words incorrectly in listening part A, that's fine. In listening part B, I think also that would be fine. Yeah, in reading, if you get the spelling wrong, it will be marked as wrong, okay, in reading part A. Jay, how long are the memberships valid on E2Language? Budget package, 6 months. Bronze, silver, gold, platinum, 1 year. So it's quite generous. Okay, this is a great question. Jay, in reading part A, will I have to use synonyms to fill the gap or just the same word, but maybe transform the word from, you know, prescription to prescriptive, for example? The answer to that is I'm not 100% sure. I'm almost entirely sure that you do not have to use synonyms. You use the same word or phrase, but you may need to transform it slightly. But just, I don't want to be, I'm not certain about that. Jay, in speaking, what happens if we don't finish all the tasks on the role play card because of a lack of time? Are we penalized for that? This is probably the hardest thing about speaking is, okay, you have 5 minutes to go through that role play. And let's say you have 5 tasks, okay? You know, various things you need to do, like advise, recommend, you know, those key verbs that tell you what you need to do. You have to, if you got 5 tasks in 5 minutes, well, you should be spending about a minute on each task. You need to sort of be conscious. You don't want to just go bang, 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 bang in 1 minute, okay? So there's enough time to sort of have a conversation and to ask a few questions and, you know, keep the conversation moving back and forth and then move to the next task. Now, when you move between tasks, it's often, or it is a very good idea to say, okay, now that we've discussed your diet, I would like to move on and talk about exercise. So how much exercise do you do each week? You know, make it very clear when you're moving between the tasks. Okay, now that we've done this, let's do this. Now that we've talked about this, I'd like to talk about this. Guys, I'm burning out. I'm going to need a cup of tea and some peanut butter to keep me going for the rest of the day. Unfortunately, I can't stick around and answer all of your questions. If you do need help with anything, feel free to go to help.e2language.com. Also check out our blog. We've got lots of articles on the OET on our blog, which is e2language.blog, I believe, or blog.e2language.com, I think, something like that. Yeah, cool. Yep. If you're taking the test tomorrow, I wish you all the very best. If you're taking the test in August, definitely sign up to one of our packages now. If you're taking the test in September, the first OET 2.0, our course will be ready on August the 13th with 1 full month ready for you to start preparing for OET 2.0. I think OET 2.0 is an excellent test, by the way. I think it's an improvement on the current test. I don't think it's easier. I think it's clearer what you need to do. Cool. Anyway, I'll leave it there. Thanks for coming along. I hope it was helpful. This video will stick on YouTube. Again, if you're on YouTube, click the subscribe button. I'll see you guys soon.